Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about gout and its treatment. Okay. So first of all, what is gout? What is the main characteristic feature of gout is it is mainly due to elevated serum uric acid levels. Okay. Due to mainly elevated serum uric acid levels, it will cause gouty arthritis. Okay. So uric acid has low water solubility. So it will have low water solubility. So it get precipitated in joints, kidneys and subcutaneous tissue. Okay. This is how the pathophysiology. Okay. Due to its low water solubility, it get precipitated in joints, kidneys and subcutaneous tissue. Okay. So what are the drugs which will cause hyperuricemia? Examples of those things will be thiazide drugs, loop diuretic drugs, ethambutol, clofebrate and chemotherapeutic agents. Why chemotherapeutic agents? Means chemotherapeutic agents, they will cause more breakdown of protein. Obviously when there is more breakdown of protein and nucleic acid, there will be more production of uric acid. So obviously when there is more production of uric acid, it will be get deposited in joints, kidneys and subcutaneous tissue. Therefore it will cause elevation of hyperuricemia, finally land up a gout. Okay. So what is the treatment of gout? Normally, it will be two conditions, acute gout and chronic gout. For acute gout, we will use drugs like NSAIDs, colchicine and steroid. Okay. For chronic gout, obviously chronic gout conditions, first we have to decrease the synthesis of uric acid. Okay. First we have to decrease the synthesis. Next we have to increase the excretion. Next will be increase the metabolism of uric acid. Okay. So by these three mechanisms, we will use to treat in chronic gout patient. First we drug decreasing this one decreasing synthesis of uric acid. That means we have to decrease the synthesis of production of uric acid by the using of drugs like allopurinol. It is a drug of choice and febuxostat. Okay. Next is drugs increasing excretion. By increasing excretion means by decreasing reabsorption in the tubular, okay, renal tubules. Once we are inhibiting the reabsorption, obviously it will be excrete more. Okay. What are the drugs like probenecid, lesironide? Okay. Next sulfipyrazone. Next group will be which next is drugs increasing metabolism of uric acid. By increasing metabolism, it will make soluble, insoluble to soluble. Okay. What are the group drugs will have? Rasburicase and pegloticase. Okay. Rasburicase is a recombinant drug. Pegloticase is a newly molecule. Okay. So these are the drugs and used in treatment. So we will see each one in the following slide. Okay. So acute gout. Acute gout is a severe inflammation of joint due to deposition of uric acid crystals. Okay. So main drug will be NSAID. It is a drug of choice. That drug will be indomethacin. Okay. Next group will be in NSAID. Aspirin will not use in this condition. Why? Because aspirin will cause adverse effect will be hyperuricemia. Okay. Once here in gout condition, it is there will be rising of uric acid. As if you are reading aspirin means it will be aggravate symptoms. So will not use aspirin in gouty patient. Okay. That's why aspirin will not be used in gout. Okay. In NSAID will be drug of choice will be indomethacin. Next group will be in acute gout colchicine. It is more effective and faster acting than NSAID, but it will be now it will be we can't use because of its toxicity. Okay. Colchicine will be more effective but fast acting also. Because of having more toxicity, we will not use. We will go with NSAID only. Okay. So what are the toxicity we'll use? Right? What are the toxicities of colchicine? Right? Diarrhea is most common. This is an MCQ. Normally, if you are giving colchicine, we'll go with nephrotoxicity. Okay. But most common this toxicity or most common adverse effect of colchicine will be diarrhea. Okay. So that's the main thing I am mentioning here. Diarrhea is the most common. Nephrotoxicity is also there, but most common will be diarrhea. And nephrotoxicity, bone marrow depression, and myopathy. These are the toxicities of colchicine. That's why we are not using colchicine. We'll go with NSAID. Next will be corticosteroids. It will be using in acute condition to reduce the pain. Okay. Next, chronic gout. Next, we'll discuss chronic gout. Okay, chronic gout will have three groups of drugs. That is, drugs decreasing synthesis of uric acid, drugs increasing excretion of uric acid, drugs increasing metabolism of uric acid. First, we will see drugs decreasing synthesis of uric acid. In this, we have two drugs. That is, allopurinol and febuxostat. Among these two, drug of choice will be allopurinol. Okay, these two drugs will act by inhibit xanthine oxide enzyme. Once they inhibiting xanthine oxide, there will be no production of uric acid. obviously decrease uric acid in the blood level. So it will cause hypouricemia. So there how patient will have symptoms relief. Okay. Next will be allopurinol is contraindicated in acute gout. It will be, even it is drug of choice for chronic gout, but we can't use in acute gout because of they will have chance of development inflammation. That's why we will not use in acute gout. Among these two drugs, allopurinol and febuxostat will be safe in using renal patient compared to allopurinol. Okay. Next, coming to the drugs increasing excretion of uric acid. Okay. In this group, we have probenecid, lesuronate, and sulfenpyrazone. Among these three drugs, okay, they will act mainly through competitively inhibit tubular reabsorption in proximal tubule. Okay, they will inhibit the tubular reabsorption of uric acid. Once they inhibit the tubular reabsorption, what will happen? Obviously, it will increase excretion of more uric acid. So obviously, leads to cause decrease uric acid in the blood level because they are inhibiting reabsorption. Okay, so once they are inhibiting reabsorption, it will enhance the excretion of uric acid from the blood to in urine. Okay. These drugs will affect you when the patient will have normal kidneys only. When the patient is having renal diseases or renal damage problem, obviously these drugs will not be effective in those patients because obviously the kidney is not filtering or reabsorption properly. So these drugs main action will be they are inhibiting the reabsorption. Okay. So once the kidney is not functioning well, these drugs also will not functioning in those patients. So in kidney or renal disease patient, these drugs will not be effective. Okay. Next is drugs increasing metabolism of uric acid. In this drugs will have rasburicase and pegloticase. Okay. Rasburicase is a recombinant urate oxidase enzyme. Okay. So this is recombinantly developed molecule. Normally in the human body doesn't contains urate oxidase enzyme. It is normally present in buds like that only. Because this urate oxidase enzyme will convert insoluble uric acid to soluble uric acid like allodyne. Okay. So once it becomes soluble, obviously it will get absorbed or it will get excreted out of the body. Okay. So that's how it will help in conversion of that is helps in conversion of insoluble to the soluble. That's why it will be helpful in metabolism. Okay. So these drugs normally useful in which patient means resistant to chronic gout patients. Okay. So the normally resistance to allopurinol or febuxostat in those patients will use these drugs. Okay. How they will act? They will help in metabolism of insoluble uric acid to soluble allantoin. Okay. So drugs will be rasburicase. This is a recombinant developed molecule. Pegloticase. This is a newly molecule. Okay. That's all regarding gout.